Hi everyone, so today's video I'll basically be discussing a common procedure when it comes to feeding a patient that has difficulty in swallowing, or commonly known as dysphagia. So basically when it comes to dysphagia, you have oropharyngeal and you have esophageal dysphagia. So with esophageal dysphagia, some of the causes can be foreign bodies, achalasia, which is when the lower esophageal muscles are not relaxed, also tumors that may occur in the esophagus, as well as we have oropharyngeal dysphagia, which can be neurological damage or neurological disorders such as stroke and spinal cord injuries, and as well as like disorders such as Parkinson's disease or muscular dystrophy, as well as certain treatments when it comes to cancer such as radiation can also make it difficult into swallowing. When it comes to dysphagia, you do have some risk factors such as aging, so the normal wear and tear of the esophageal muscles as you age, and a greater risk of certain disorders such as Parkinson's disease or strokes. But it's also important to note that age is not normal when it comes to it's not a normal sign when it comes to dysphagia. And as well as we have some complications when it comes to dysphagia, such as malnutrition, dehydration, and weight loss, because adequate nutrition and fluids may not be taken by the patient because of the difficulty in swallowing. When it comes to complications, we also have complications in terms of choking. So if food gets blocked in the airway and you don't provide adequate first aid treatment such as the Heimlich maneuver, death can occur, and as well as aspiration pneumonia. So when the person is trying to swallow the food, bacteria may enter the lungs as they're trying to swallow, and this may cause aspiration pneumonia. Make sure the patient is sitting in the correct position. This would be the incorrect way for the patient to be sitting, but this would be the correct way, sitting up straight in the chair that they're in or wheelchair. Then you'd feed the patient. Make sure you're sitting on the side of the patient or in front of the patient. And make sure you put small quantities of the food into the patient's mouth, not too many. Leave the patient to cough vigorously. Check if the patient has swallowed all the food that is in their mouth. And never stand behind the patient when you're feeding. When it comes to the patient choking, never slap the patient on the back or provide water, bread, or any other solid food or liquid. Rather let the patient just cough vigorously.